How is pediatric Graves' disease diagnosed? Imagine a young child showing signs of unusual tiredness, rapid heartbeat, and maybe even eye bulging. These clues can point toward a condition called Graves' disease, but confirming it takes a careful process. Doctors start by listening to the child's story and doing a physical exam. They look for a swollen thyroid gland, which feels like a small bump in the neck, and check for eye changes like bulging eyes, which are common in Graves' disease. They also ask about family history because autoimmune thyroid conditions can run in families. Next, blood tests are essential. The first one measures thyroid-stimulating hormone, or TSH. In Graves' disease, TSH levels are usually very low or even undetectable because the body senses too much thyroid hormone and tries to slow down production. Then, they check levels of free thyroxine and free triiodothyronine, which are the main thyroid hormones. In hyperthyroidism, these are elevated, confirming that the thyroid is overactive. Sometimes, only one hormone like free triiodothyronine is high, which is called T3 toxicosis. To confirm that the immune system is involved, doctors look for specific antibodies in the blood. The most important are thyroid receptor antibodies, or thyroid-stimulating immunoglobulins. These antibodies stimulate the thyroid to produce too much hormone and are very specific for Graves' disease. Their presence helps confirm the diagnosis and can also give clues about how likely the disease is to come back after treatment. Other antibodies, like antithyroid peroxidase and antithyroglobulin, may be checked but are less specific. In some cases, especially if antibody tests are not clear, imaging tests are used. The radioactive iodine uptake test measures how much iodine the thyroid absorbs. In Graves' disease, the gland absorbs a lot of iodine evenly, which helps distinguish it from other causes of hyperthyroidism like thyroiditis or nodules. An ultrasound can also be done to see the size of the thyroid and how much blood flow it has, which is often increased in Graves' disease. Diagnosing hyperthyroidism in children requires careful attention because symptoms can sometimes be mistaken for behavioral or mental health issues. It's important for healthcare providers to consider all signs, lab results, and imaging to make an accurate diagnosis. Early diagnosis helps in choosing the right treatment and managing the condition effectively. Remember, every child is different, and a healthcare professional will tailor the approach to each individual. If you notice any signs of thyroid overactivity in a child, consulting a doctor is the best step to ensure proper care and support for living well with thyroid conditions.